Hey guys, good evening. We're going to wait just a few minutes and let everybody get kind of logged on here, and then we'll get rocking and rolling. So give us just another couple minutes, and then we will be getting started. Just another minute or two, and then we'll be rocking and rolling. All right, we're going to get ready to get rolling here. Hope everybody is having a wonderful week. All right. I'm just going to go ahead and throw this out there, and basically we're going to be doing a Q&A, I believe next week. I believe it's scheduled for next week. So if you guys have any questions about anything we're going to cover tonight or chronic infections, you're more than welcome to submit them as we go tonight, right here in the question on your panel. And then we'll try to get some of those answered at your next or at our next webinar. So like I said, if you guys do have any questions, you can always jot them in there, or you can send us an email, and we'll try to address most of those questions at our next webinar. So just, kind of for you guys, for a heads up to be thinking about those kind of things as we go. All right, so let's get rolling here. So we're going to be talking about disease triggers, and this one is part 2A. Okay, we're focusing on chronic infections with this webinar. And so again, most of you on here, I believe you know us, and so this is us. And I'm Dr. Justin Snyder. I'm a board certified chiropractic internist, and I'm also an upper cervical chiropractor, and I've also done some other advanced studies. And so currently right now I am working towards a advanced study in metabolic endocrinology, and then also working towards a diplomate in anti-aging and functional medicine, which is an AMA certification. So like I said, I've done studies in different things, peptides and regenerative medicine and some of those anti-aging and things. So but this is us. This is the team of owners. And then again, what we have is we have a great staff, And so we're very blessed to have them. So with that being said, in this series, the first one we hit on were, triggers that create an abnormal physiology. And so, just kind of a refresher. Remember, when we're talking about health, understand that in order to be healthy, we really have to be able to adapt to changes of internal and external environment, and our bodies has to be able to perform those adaptations. And so when we have things that push or stress our body's physiology, what we can have is an inability to be able to adapt to those changes. And so that's kind of what we're breaking down here with these triggers is, what are things that stress our physiology? What are things that push our body down a path where it is going to be more difficult to overcome? And so the food sensitivities was the first one we dove into, and we talked about understanding what foods are creating inflammation, and again, the testing that goes along with that, but also understanding the importance of the gut. And we really kind of tied that in last time when we talked about the gut health and GI infections. Last time we also discussed Lyme and Lyme disease and co-infections of Lyme. We discussed Epstein-Barr virus. We discussed cytomegalovirus, oral infections, GI infections. We can talk about mold, but we're going to get to that at another date. And mycotoxins. But chronic infections, things that like to kind of hide right underneath the surface or smolder, those guys can create a major trigger or a stressor to abnormal physiology. And so, we really hit on a lot of that last time. So tonight, I want to talk about some of the major kind of therapies that we utilize to help combat some of these infections. And, again, these things are not just for infection, there are other benefits, but, we do tend to see some of these therapies do very well for the infection. And, sometimes, these therapies are there to kill or inactivate pathogens. Other times they're there to help stimulate your immune system and support your immune system. And so, again, your body's the one that's having to do the healing, but we want to help it. And so, tonight we're going to talk about that. And so, one of the things I do want to say about the chronic infections is, we're not going to talk about nutrients and herbs and some of those things because there are so many nutrients, there are so many different herbs, and every case is unique. Some cases, for instance, urinary tract infections, you may see, one herb work really well for one person and then it not work very well for the next person. And they may have the exact same type of pathogen. So everybody's a little bit unique. Everybody's chemistry is unique. And so we don't always see, uh, the same response with herbs and nutrition. And so I'm not going to say that they're not big, because they are. They're a big part of what we do and what we utilize to help patients in different conditions. But again, there's so many different vitamins and herbs, and sometimes it's all about their synergism of those. They play with each other and they strengthen the effects of each other and those things. So we would be here for a couple hours just kind of hitting the big ones. So we're gonna kind of take away that aspect tonight. We're not going to hit too much on that, and so we are going to focus though on some of the heavier hitting things, and I'm going to try to dive in there. So let's kind of roll into the first one. And the first big one that we use is called major autohemotherapy. We call that MAH for short. and it is an ozone therapy. It's an ozone treatment. Some of you may or may not have heard of it. Sorry, had to take a drink there, swig of water. Um, but so ozone therapy is something that not a lot of people utilize, and it is something that has been around for a long time. Based off the medical literature, it's been in use for over 150 years, and it was specifically used to treat infections and wounds, different diseases. It's been well documented. It's been used to disinfect drinking water, and ozone was known to treat as many as 114 diseases. And ozone therapy was, like I said, been in use since the 1800s. In 1896, Nikola Tesla patented the first ozone generator. Okay, and so ozone in '03 had a lot of antibacterial properties, and like I said, it was used heavily for the infection side of things. And so there is a lot of documented usage of ozone, and understanding that ozone, when used properly, is very, very effective. And so it has been heavily studied. It's been used in Germany for many, many, many years. And so understanding when we use ozone, we're not using ozone from a breathing standpoint, because ozone in the lungs is very, very bad. Okay. So we don't ever use ozone in a respiratory way. Okay. It is utilized different. And so major autohemotherapy is a process in which we take somebody's blood, and we basically you donate your own blood. Okay. And so you take your blood, and then ozone is injected into the blood, right, while it's out of the body. And once it's injected, it's mixed, and then that blood becomes hyperoxygenated. And if there's any infection in there, what it can do is, I mean, it can do a number of things, but it helps to, it helps to disinfect, it helps to kill, and it helps to basically attenuate the immune function and response, and it helps to basically uh, kill pathogens. Okay, and so and then we give that blood back to the body, back to you. So it's your blood, and so we take it out of the body and do what we need to do with it. And once we've mixed it and we treated it, then we give it right back. And so by doing that, it is very, very safe. And but again, the mechanisms of action is it helps to inactivate bacteria, viruses, fungus, yeast, protozoa. It stimulates oxygen metabolism, and it activates the immune system. And that's all from the medical literature, right? It's something that has been around and was widely used, very on. And it was very, very effective. Um, and so, and that's what the medical literature actually states is diseases treated are infected wounds, circulatory disorders, geriatric conditions, macular degeneration, viral diseases, rheumatism, arthritis, cancer, SARS, and AIDS. And that's out of the National Institute of Health's article. Okay. So, again, these were things, this was very commonly used, and as our disinfectant. And so, things now and technology now has allowed us to be a little bit more effective with its use and safe, honestly. But it is a major player, man. And and so I can tell you, from personal experience, I had not been exposed to this until several years ago. And, I have personally had the therapy done, and I have seen some pretty awesome stuff just from having it. And so, again, it's something that, we do pretty frequently in the office with a lot of conditions, and a lot of them have shown very, very, very good results. And so, this is a what it looks like. Okay. And so what you can see here is this is one of our awesome patients, and we love her, and she gave us permission to take her picture and show it for you guys, and she gave us permission to share her story with you guys. But as you can see on the left here, this is her blood. It is has already been treated with the ozone, and it is hanging up, and she is getting her blood back. And so you can see there on the right that she is just letting it come back. And so that blood is more red because it's been hyperoxygenated. And so, and then you see the ozone generator there. And so this is Miss Brenda, and Miss Brenda's case is awesome. It was almost 3 years ago that she was having debilitating headaches, and they got so severe that her husband took her to the emergency room. And when they did some imaging, they found out she had a brain tumor, and she had a glioblastoma, and that has a very, very, very high fatality rate. And so the doctor told her that day at the ER that if she did nothing, that she probably had 3 months to live, and that if she had surgery, she might have 6 months to live. And so Miss Brenda, she ended up going home, and she ended up going and seeing some doctors at Mayo. Very similar story, kind of outlook is what they gave her. And she worked with our DO that comes in on some of the nutrition side, and then he ordered some of these therapies for her as a conjunctive as part of our integrative oncology. And so she went to Mayo. She had the surgery done where they removed the brain tumors, and she did some chemo, and then she did a lot of the adjunctive therapies, which the MAH being one, and some high dose vitamin C being another. And then again, she really pounded away at her diet and all those things. And so basically, she was given a 5% chance to live more than 6 months. And this was her today, as a matter of fact, in the office almost 2.5 years later. And so she has posted some stuff on our page on our Facebook, and shared her MRI, and and she was doing phenomenal. She was completely tumor free in her brain. And the way those glioblastomas work is it's kind of like a root, and as it grows down, it branches and creates new tumors. And so she had one tumor that had completely regressed and was not even visible on the MRI. And so about 6 months later, she ended up having a kind of a relapse. But again, she has been doing phenomenal, and she has more than outlived her life expectancy with that diagnosis. And but she is a trooper, and she is one that she will absolutely share her story. And so she looks amazing to have had gone through everything she's had. But again, this was just an adjunctive therapy that she did on top of the surgery and some of those things. And so but the MAH is something that, again, it is very, very powerful, and it does some pretty awesome stuff. So but this is what it looks like if you've never had it done. And so a lot of times when we use MAH, when we use that ozone therapy, we also will utilize something called UVBI, or ultraviolet blood irradiation. And so UVBI is pretty awesome as well. And so the medical literature actually has an article in the National Institute of Health that is titled "Ultraviolet Blood Irradiation: Is It Time to Remember the Cure That Time Forgot?" And so ultraviolet blood irradiation has been around since the 40s, and it was also used to treat many diseases, including septicemia, pneumonia, tuberculosis, arthritis, asthma, poliomyelitis. And it was carried out by several physicians studying the American Journal of Surgery. But when antibiotics started to come on the scene, the use of UVI declined, and so did ozone, because it became a lot easier and for a short while as effective to just give somebody an antibiotic. It was definitely something that was easy and I don't want to say more affordable, but it was definitely easy to give somebody a script of antibiotics and send them on, versus having to do these IV therapies on them pretty consistently. So, but UVBI, like I said, I mean, it says that the article says it all. Is it time to remember the cure that time forgot? And so UVBI, and as you can see on the left here, this is a picture, and this is part of what we do. So when we do an MAH, sometimes, depending on the case, we will add the UVBI. And what we will do is when you are actually donating your blood, okay? Oh, sorry, let me come back. When you are donating your blood, the blood as it drains out of the vein, it will go down the tubing, and that tubing will run through a ultraviolet light. Okay, and you can see our bigger unit in the center here, and this is the Champion. And so this one actually has more lights that we run the blood through, and it's a bigger tubing and it's more specialized to be more effective. But what it does is that blood will run through a glass tube in the machine right there. And as the blood drains through that machine, it will be exposed to ultraviolet irradiation. And so it will come out of the person, go through the ultraviolet light and be radiated, and then it'll go into the collection bag, which is like the same kind of bag you would use if you were donating blood. And then you will get the ozone therapy, right? And then when it's time to give you back your blood, then we hang the blood back up and it drains out and goes back through the light again. So we hit it twice, okay? And like I said, in our Champion unit, it's a little bit bigger tubing, it's longer, you get more light exposure, and so it tends to give you a little bit more effectiveness. But it's a more expensive machine and tubing to use, so it does cost a little bit more for the therapy. But again, ultraviolet blood irradiation. This is a book on the left that we use to kind of explain things to patients. It's by Tom Lowe, and he is the director of the Society of Progressive Medical Education, and he oversees a lot of different ozone, okay, treatments. And so this is ultraviolet blood irradiation. And so you can see right there from chapter 5, more oxygen, better blood flow, healthier red blood cells, and makes for healing. And so the effects of doing the ultraviolet blood irradiation is you will see typically an increased tolerance towards radiation and chemotherapy when it's used as an adjunctive. It does help increase oxygenation and improves blood dilation, blood flow. It stimulates production of red blood cells, and then you can see some changes there. And so as far as blood irradiation, again, it helps to lower fibrin. It helps to improve white blood cells and hemoglobin. It helps to increase the lymphocytes. I mean, it just helps to improve the blood, period. And again, kind of looking at everything with UVBI. Okay, there's different conditions that have been used with UVBI, and so conditions specifically that have seen improvements are different types of arthritises and bursitis. You'll see different claudications and vascular disorders, asthma, sinusitis, viral stuff, autoimmune and different infections, and that was, like I said, that was very common in the National Institute of Health in that article. And part of what it was used for, it was used mainly for infections. And so And again, it's ultraviolet light. It's it is not part of kind of the wavelengths that it's very close to the lower end of the wavelength that you can see, but it will do pretty awesome things. And so again, when we look at these therapies, like I said, a lot of times we will use the ultraviolet blood irradiation therapy in junction with the major autohemotherapy. And so we'll do both of these a lot of times together, because just, I mean, it's synergistically, the effects there are very synergistic, and so they work together. They don't do the same thing, but they will definitely improve and help each other in versus just a individual therapy or treatment. And so, again, the UVBI, doing that with the ozone, it doesn't take any more time to add ultraviolet blood irradiation than what it does to do a major hemotherapy. And so it's not like you're adding an extra time or step, but in a sense, you are adding an extra step. But again, the effects of it are great. And so uh, when we look at the UVBI, again, I can't tell you how many times I've seen improvements with different cases and chronic infections and those things. And so, very, very cool, very, very unique in the actual application of this. And so, I will say that, depending on the situation, these therapies, they can do pretty cool stuff in just one therapy, but you can't treat all of the blood in the body at one time. And so, unfortunately, you really need to have several rounds of these therapies if you really have a chronic infection, like something like Lyme, or mono Epstein-Barr, or influenza. If you got the flu, I mean, I've seen patients with full-blown flu come in and get these two therapies, and we do some IV nutrition with it, and I'm telling you, I mean, within 12 hours they are almost completely turned around. They go from having flu and feeling like they've been hit by a truck to feeling like they maybe have a mild cold in 12 hours. And I've seen a full-blown mono case, not being able to get out of bed for a week, and I mean, just barely can go. And in 24 hours, being, he said 85 to 90% better, in just 24 hours after one of these treatments. And so, again, the one treatment for an active viral infection, I mean, it doesn't necessarily have to be viral, but one treatment after infection can absolutely make a big difference. Um, but we typically, depending on the situation in the case, we usually will recommend at least 4 of these therapies, and sometimes even more, because, like I said, you can't treat all of the blood at one time. And so, by doing several applications, you can start to treat more of the blood that may have been not treated. And then also, you're trying to help support a more normalization of the physiology when there is an infection. Okay. Another one that we use is IV vitamin C. And, we use several different IVs and nutrition things on the IV. And honestly, IV vitamin C, again, it's something that I absolutely love. I have, obviously done some IV vitamin C, but the benefits for IV vitamin C and really IV nutrition is tremendous, because, like we've talked about in past webinars, nutrition has to be absorbed through the gut. And between the time it enters your mouth until the time it enters your bloodstream, and even past that, when we're talking about trying to get nutrients into the cells, you can still have some difficulty doing that. And so, step one, or the first big hurdle that anybody has, is when we talk about nutrients, is getting it into the blood. If you don't get it into the blood, then you can't get it into the cells. And if you don't get it into the cells, you're not going to utilize it. You can't, your body can't use it. And so, you know, unfortunately, as we age, as we have more GI dysfunction, sometimes it's stress, sometimes it's a hormonal dysregulation, like, cortisol, altered cortisol levels. Sometimes it's, drugs or other things that would inhibit absorption. There's a lot of things that can interfere and interact with your body's ability to digest food and absorb nutrients. Okay. And so, again, when you take, let's take B12, for example. When you take a B12 tablet or supplement, there's a lot that has to happen in order for you to get that B12 into your blood. And even then, you've got to be able to get it from your blood into your cells. And you're not going to absorb all of the B12 in that vitamin. Okay. You're just not going to do it. And so, same thing for vitamin C. And, like I said, we use a wide variety of different nutrients when we do IV therapies. But tonight, we're going to talk more specifically about vitamin C. And so, vitamin C, it can be an antiviral at high doses. It can act as an antiviral. It can act as an antibacterial. And so it can act as an anti-inflammatory agent in higher doses. And so why do we use IV vitamin C? Well, because even if you load it up on all the vitamin C you could take by mouth, your body, your GI system is not going to let you absorb a lot of that. And again, if you don't get it in the blood at a therapeutic level, you're not going to see the benefits that come with it. And so part of getting that blood level up, the only way you can do that with vitamin C effectively, without having, diarrhea and some of those things, is to do it intravenously. And so, when you do it intravenously, you get 100% absorption, right? You get some hydration with that as well. Okay. And so, and you can see the therapeutic levels and do, you can get what you're actually trying to get out of the vitamin C. And so, it's just, as far as hitting it, that's it. If you do those three IV therapies, and we will in cases do all three at one, in one session with a person. And so when you do those, man, synergistically, you're hitting the body with some punch. And especially when you think about an infectious agent, if your immune system's struggling, that's a pretty awesome combo right there. And so, when we think about vitamin C, and this is kind of, it's just a refresher of some of the things that we've hit on in the past. But vitamin C, the levels in white blood cells are tens of times higher in plasma, right? Which means that those cells, your immune cells, your white blood cells, utilize a lot of vitamin C, right? And it will absolutely affect the production of interferon and replication of viruses. And guess what also does those two things? Ultraviolet blood irradiation and ozone. So when you do all three, guess what? You're really hitting that hard. So we absolutely will see that. Vitamin C, it will participate in enzymatic synthesis of dopamine and carnitine. So again, depression and fatigue, those things can also be affected by vitamin C and vitamin C deficiencies. And so when we start thinking about vitamin C, man, it's a superhero, and it does some pretty awesome stuff. Again, infections, they increase oxidative stress. Okay, so on one hand, we want to be oxidative. High doses of vitamin C kind of does twofold. Initially, with the high dose of vitamin C, it becomes an oxidative therapy, but because of its increasing of oxidation, it will kick in the body's antioxidation system, and as the blood level decreases, the vitamin C will then in turn be used as a antioxidant. And so you kind of get the best of both worlds there. And so, stress of an infection can drive oxidative stress, and that can drive inflammation. And so the immune system needs inflammation during infection to kill the infection and stimulate the immune system, right? You need to oxidize those viruses. But again, like I said, by doing such with vitamin C, you can actually kind of hit a dual effect. You can kind of periodically increase the oxidative effect, and then as time progresses, you will start to turn on the antioxidant effect. So, when we think about infections, this COVID virus, right? They were using a lot of IV vitamin C in China, okay? And it's been used also in New York and some of these places. And, they were using, I've heard different numbers from different areas and different doctors. But I've heard anywhere from 1,000 milligrams, which is really nothing, upwards to 50 grams, okay? And so in an IV. And so a lot of places were using IV vitamin C, and they were using about 10 to 15 grams of IV vitamin C daily for several days. And so with some of these infections, again, you can't get a blood level of 10 grams of vitamin C by taking 1,000 milligrams, of vitamin C orally. You're not going to absorb all of that. Even if you took 10 pills of 1,000 milligrams of vitamin C every day, that would give you 10 grams orally. But again, your body's not going to let you absorb all of that. And so even if you wanted to take 10 or 15 pills of that a day, you're still not going to get the same absorption and blood level as if you did it in an IV. And so the only way to really do that is through intravenous therapy. And so again, that's something that we absolutely use. Something else that is used with different chronic infections are peptides, and there are a good many different peptides, and there are different peptides that will be used for different types of infections or immune challenges. And so, but understanding that tonight, I really want to just focus on thymosin alpha 1. And so we're going to talk about TA1 in just a minute, but to kind of give you an understanding of peptides, I heard somebody, speaking on peptides, and it probably gave me the best example of what a peptide is or how it works. And that is, he said, imagine if you have a hormone that unlocks multiple cells. It's like a master key. It'll unlock multiple doors, okay? But you only want to unlock the back door. Well, that's what a peptide is. A peptide is a chain of amino acids that are sequenced in a way that only triggers one pathway typically in the human body, okay? So it may be a replication of something your body makes, or it may be a replication of something that looks very similar and acts similar to something your body makes, right? And it's amino acids. So they're not chemicals, okay? They are not chemicals that stimulate a pathway or do something. So they don't work like a drug in that aspect because they are amino acids, but they are a formulation of a drug because they have to be compounded, okay? And when we look at peptides and we think about how that works, if you wanted to stimulate just one specific pathway, you can use peptides, and it's going to be a safer way in many cases to stimulate a specific pathway of the body. And so we've talked a little bit in the past about thymosin alpha 1. And one of the reasons why I love thymosin alpha 1 as a peptide is because it is a naturally occurring thymic peptide. Okay, so you have in your neck, close to your thyroid gland, something called the thymus gland. The thymus gland is very important in developing an immune system when you are a child. Okay, and so the thymus gland is very active and it's larger when you are a child, and it is helping to stimulate and activate your immune system, and it's helping your immune system to become intelligent. It's helping it to build immunity to different pathogens and viruses, bacteria. And so when you put all these things in your mouth as a baby and as a toddler, and playing in the dirt and all these different microbes and all of these different things, your thymus gland is helping your immune system to respond to those things appropriately, and it's there to help your immune system to regulate itself. Okay, and so the thymus gland secretes things called thymulins. Okay, and so basically they are like a peptide. Okay, and they do different things. And so thymosin alpha 1 is just one of the thymulins that the thymus gland does secrete. Okay, and understanding that as we age, the thymus gland becomes less and less active, and that's just normal. And usually, by the time we're a teenager or in our early 20s, we've been exposed to just about all the things that we will typically, in a normal day-to-day contact, come into contact with. And so understanding that, our immune system is always trying to activate and stimulate itself. But, after 20 years, our immune system's seen a thing or two, right? It's like farmer's insurance, right? And so understand that the thymus gland starts to become less biologically active, and it will start to shrink in size. And so usually by around the age of 30, give or take, and everybody's a little different, but usually by around 30, you don't have very much function at all of the thymus gland. And so women tend to have less thymulins secretions as men, which is one reason why you tend to see women tend to fight and deal with more chronic viral infections. But understanding that when we use thymosin alpha 1, basically what we're using is we're using we're using a peptide to help to stimulate and really regulate your immune system. So it does act as a regulator of inflammation and also adaptive immune response. And your immune system should be functioning in a very effective manner. And so, but when it does not, you start seeing dysfunction, and that could be because of chronic infections, right? It could be because of other triggers that we're going to talk about. But again, you know, this dysfunction can start to cause disease processes, and your immune system can start to struggle with trying to again adapt and respond to different immune challenges. And so thymosin alpha 1 has been used for quite a while. I believe it's since 1976, I believe, is when it was kind of discovered. And so it is highly used. It's used as a registered drug by the name of Zadaxin. And so Zadaxin is a little bit different than just straight thymosin alpha 1. But like I said, it has been used and has a very high safety efficacy. And so understanding that, again, we could go on on thymosin alpha 1, but we have patients who have used it and have done phenomenal with it. But understanding that every case is going to be a little bit different. And so here's the deal. We've kind of gone over this with you guys. With this immune system, with COVID, with everything out there, we've really got to focus on getting our immune system functioning better and getting healthier. And that means if we're dealing with chronic infection, we've got to start stepping in there and taking care of that and helping our bodies get back to a healthy function and overcoming these infections. And so one of the things we've been doing for our patients, is to determine if you're a candidate for some of these therapies or peptide program. We're offering you a $49 consultation for that specifically. Normally, if you're not a patient, you're paying $235. And if you are a patient, and I'm referring you, or we're doing something, individually, I mean, it's an $85 consultation. So for right now, it's only $49. And then we have some IV therapy specials as well. And so what we've done is we've done some IVC, and we've cut those down for you as well. Those are pretty significant savings. And so pretty much, trying to do things as cheap as we can, as less expensive as we can for you, so that you guys can get some of these benefits. So that is there for you. If you have, questions, please, please, send us your questions. And we will try to answer those. So hopefully you guys learned a few things. Like I said, we could go on and on and on about different herbs and vitamins and nutrients and those kind of things, but we'll be here until midnight easy. And so these are the big heavier hitters. When we have somebody with chronic infections, these are the one things that we're going to pull out as kind of our big guns. And then we're going to use the lifestyle, nutrition, and diet and some of those things as, a supporting adjunctive with it. And so again, it's utilized in so many different types of conditions, and we've seen some really awesome stuff. So if you have any questions, please, shoot us an email. You can jot your question here for just a minute. And I hope you guys have gotten something out of this series, and please give us some feedback. And so our next trigger we're going to be hitting on is environmental toxins. And we're going to talk about toxins after our next Q&A. And so we talk about food sensitivities, we talk about chronic infections. The next big one that is very commonly seen and a lot of times missed is environmental toxins. And so mold toxicity is also one thing that we will discuss in that. But environmental toxins can definitely wreak havoc on you and can definitely trigger abnormal physiology. So don't want to miss that one. Like I said, our next webinar will be a Q&A. And then after that, we'll get back on to number 3 of our triggers. And so again, if you guys have any questions, please feel free to shoot us an email, and schedule an appointment. Share this with your friends and family. If they are struggling with different health conditions, they need help. And sometimes, you're hearing things that they've never heard. And so please share that. And like I said, if we can help them, we'll be happy to send them any information. Make sure you check out our Facebook page and follow us and try to stay up to date. We utilize our Facebook page as well as our email list to let you guys know about different specials and different upcoming webinars and different things that we're doing. So if you guys don't follow that, please check us out at our Facebook page at My Pro Health Center. And if you're not on our email waiting list, please give us a call or shoot us an email so we can get you put on. Hopefully you guys learned something tonight. Thank you so much for taking time out of your night to listen and learn. And we will see you guys next time.